It's because she had low blood sugar levels, and I prescribed her with a couple of multivitamins. This is a follow up appointment, and the basically what I'm here to do is check if her the multivitamins I gave her worked perfectly fine. I also started a meal plan, a lifestyle meal plan with her, and I'm gonna check her blood sugar to see if it's back to normal health. Do you guys understand?
Yes, Dr. Dunn.
Yes.
All right. Sounds good. Okay, how have you been?
Much better.
Yeah. Have you keep up with the meal plan?
Yes.
All right, sounds good. Hey, Miss Dims, can you hook her up to an IB, please?
Most definite.
All right.
I thought we could lay down here.
I don't know. I tried laying down at the house and they didn't let me.
Oh, wow.
Yeah, man. This game always has something.
Yeah.
So I was just checking to see if her blood sugar was back to normal so we could continue on. But yeah, it looks good. I'm glad you kept up with the multivitamins I prescribed for you and the meal plan. I guess they worked perfectly fine.
All right, that's good.
So this is Chris. He's a dental and oral doctor specialist. So he will be helping you with the braces you want. You just gotta let him know what color, etc.
What's your favorite color? What's your favorite color?
You said what?
What's your favorite color?
Black.
Black. Okay. Well, we can definitely add black to your O-rings. All right. That's how the colors are pretty much shown. But that's kind of closer to the end of the procedure. We'll definitely ask you again one more time before we start to put the O-rings on. All right. But we can go ahead and proceed with the procedure. All right. So today we're going to be doing your braces procedure. All right. I'm going to ask you to lay back real quick. Okay.
All right.
So first, I'm just gonna go ahead and check your teeth real quick. All right, I'm gonna ask you just to open your mouth up slightly for me. All right, let me position the light in real quick. All right, and I can take a look, right? I just want to make sure I get your approval before I start taking a look. All you have to do is
Yes, that's fine.
perfect. Thank you so much. All right, so I'm just gonna go ahead and inspect your teeth real quick just to make sure your teeth are in good condition. All right, just let me know if you feel any pain. All right, do you feel any pain?
No.
All right, perfect. All right, that sounds good. All right, I'm just checking for any swelling, any bleeding, okay? And you already said there's no pain, so that's really good. I'm just gonna rub your jaw gently just to make sure. Quick question, is there any sensitivity to any hot or cold items? When you drink, eat
Yes.
foods, there is?
Yes.
Okay, which one is it? Is it hot or is it cold items?
Cold.
Cold items? Okay. Just gonna write that down in my notes, okay? sometimes your teeth can just adjust differently to cold items or hot items. So I'm not gonna rule out anything in terms of cavities right now. I did check your teeth. It doesn't look like there's any underlying problems. I don't see where there is any irritation, any problems with their gums, any sores, any blisters, any cysts. I don't really see any underlying problems. I will run a scan real quick, so just give me a second. Kev, can you go ahead and run that scan in the computer room real quick for me? Just to make sure before we do this bracers procedure. Thank you so much. Just give us 1 second. Be patient. We're going to run a quick CT scan and x-ray scan, okay? For your teeth, just to make sure, like I said, there's no underlying problems before we go ahead and do this the braces procedure. All right?
All right.
Thank you so much. All right. Kev, let me know what you see down there. See anything?
No, I don't see nothing.
Okay. All right. Just double check that real quick, all right? Zoom in on the back, all right, of her teeth. Just real quick. I just want to make sure, get a double check on that. Like I said, I didn't see anything when I was using my scaler. I didn't see anything when I was using my dental probe with the human eye. All right, so
There's I just zoomed in. There's a crack in the back of her teeth. With the wisdom tooth, it's cracked.
Oh God. Okay. So it looks like we're gonna have to treat that first. Okay. With the crack in the back of your tooth before we do the braces. We don't want to put braces on any bad teeth. Okay. So let's go ahead and do that procedure real quick. I can fix you up, and then we can go ahead and presume to the braces procedure. Okay.
Okay.
All right. Just gonna remove any excess plaque and tartar first and do a quick cleaning. All right, and then I'm gonna go ahead and proceed to, like I said, fix that crack and broken tooth in the back. All right. So today I'm gonna have to do a root canal first, and once I do the root canal, I'm gonna then go ahead and do your braces procedure. I may only do. Hey Kev, did you see the crack on the top rack or the bottom rack, buddy?
The bottom rack.
Bottom rack. All right, bet. So I will go ahead and put braces on your top rack. I won't put the Archwires all the way around on the bottom rack because I'm gonna have to let this the broken tooth heal once I fix it. Okay, I'm gonna have to do a root canal, so I just don't want it to be irritated and cause problems, any soreness, because there's gonna be soreness once I put the braces on. So I'm not gonna do a full bottom rack with the Archwires. I'll probably stop maybe at your canines or a little further, but it won't go all the way to the back to your wisdom tooth. Okay. And I would definitely do a full top rack with your braces. But like I said, let me go ahead and continue with the root canal procedure. Then we'll proceed with the braces procedure. And then Dr. John will hook you up with the supplements and get you together with the nutrition facts. Okay.
All right.
Sounds good. All right, let me go ahead and get started. Hey, Doc, can you go ahead and get my tools together, please, Kev? Just make sure they're organized, and you can hand me them real quick, please.
I got you.
Thank you so much. All right, so right now, everybody just go ahead and fix your broken tooth, cracked tooth in the back, like I said. Let me wash my hands again. All right, so first I'm gonna apply a little benzocaine, and like that's a little, it's basically like Orajel, just to numb your gums and help soothe it. Okay. Then I'm gonna go ahead and apply a little lidocaine. It is gonna be in a little needle, so beware of that. It shouldn't hurt. It's gonna numb the area as well. And this is just so that you don't feel any pain when we start to do the procedure as well. All right. So I went ahead, added that lidocaine. It's mixed with an epinephrine numbing agent. I want to make sure you feel no pain as best as possible when we're going ahead and
I
fixing
try.
that back tooth. I know you already had a little bit of complications with it, so we're going to go ahead and fix that for you, all right? Then we're going to proceed with the braces, all right? So I'm creating this little incision, all right, in the top part of your tooth, which is just the crown of your tooth. And this just allows me to enter the pulp chamber. The pulp chamber is just the inner part of your tooth, okay? Like I said, I have to drill into the top of the crown of your tooth to get to the inner part, so that I can fix that broken / cracked tooth, okay? And once I do that, it's already damaged. It's already pretty much rotten in the inside part of your tooth. It's just like your body has a natural way of covering it up. And so it hardens. That bone, that tooth, it hardens. And it creates this hardened material along with the tartar and the plaque, along with the bacteria. That's why you feel that irritation. And that's why your tooth is just not really as healthy as it should be, okay? So next, we're pretty much going to remove all that pulp in your tooth, okay? All that damaged pulp, we're gonna remove it so that we can then fill it, okay? Your tooth could then continue to grow and be healthy as one, all right? So I went ahead and I removed that pulp. Like I said, I see lots of damage. So I'm glad that you came in here and got this fixed, even though you didn't know it was happening. And now we can go ahead and continue with the procedure, but then we can get those braces on there as well. All right. And I'm just going to go ahead and clean it. After I removed all the pulp, I have to clean it. All right. So I'm going to disinfect it with the little sodium hypochlorite. That helps clean the area. All right. Once I got all that pulp and that damaged bacteria out, I got all the gook out, all the little phlegm out, all the bacteria out, all the bad saliva out, all the food intake and everything, that particles that was in your tooth that helped rotten your tooth. We got all that out, right? Now we pretty much are able to treat the tooth as is, okay? And so basically now it's just a little hole or incision in your tooth where there's nothing. It's a crater in your tooth. All right, now we have to pretty much fill that tooth up so that it can be solid again and strong, all right?
All right.
So I'm gonna seal that tooth, all right, with gutta percha, and that's just really an adhesive / it's a mixture. It's an adhesive kind of, but it's really like a solid fluid. Once it hardens and it dries, it turns into a hardened solution where it's unbreakable, and it basically acts as one with your tooth, like I said, okay?
Okay.
All right. And that's just a little bit more information on it. It comes from a Southwest Asian tree. It's like a sappy material adhesive, like I explained. And it just basically hardens. It's a natural material, so you don't have to worry about it pretty much decomposing in your mouth based off of the food that you eat or the drinks that you take, all right?
All right.
Sounds good. Add a little resin on there just to harden it up. All right. And lastly, now I just need to put a crown over your tooth. And that's pretty much, since we drilled past your crown, which is the top of your tooth, into the root of your tooth, got all of it out. We filled it back in. Now we have to put a topping over your tooth again to seal it. And that's basically so your tooth is now hardened now. But now we need to make sure the top part of your tooth is pretty much similar to your other teeth, all right? And as you know, your teeth have natural indentations. They have natural grooves. We pretty much want to solidify it as a tooth now, and put a crown over top so that when you're biting, where you're chewing things back there, it doesn't pretty much impact that inside of your tooth, all right?
All right.
I like to use a metal crown. Even though it's visible, it's the best thing possible. All right. A lot of the other things are pretty much like porcelain, and they tend to crack easier. So I like to use a metal crown. Like I said, it is kind of an older thing, but it is always efficient. All right, 100% efficient because it is metal. It tends to last longer. It tends not to crack. It tends to be no long lasting problems. And in terms of longevity wise, it's way better. All right.
All right.
So I went ahead and I put that crown on. It fits perfectly. It's nice and snug. And now your teeth are pretty much clean. They're repaired and they're healthier. That problem that you had back there, that cracked tooth, that broken tooth, is now fixed. And we're now A-OK to go with the braces procedure. And like I said, I don't want the braces to impact that back tooth where your wisdom tooth was. So we fixed that. I'm gonna leave a little bit of spacing in between the arch wires so that we don't go all the way back there with the wires. We just mostly fix your top rack, and we're gonna go pretty much back to your molars, not all the way back to your wisdom teeth, for the arch wires for the braces on the bottom rack. Okay.
All right.
Sound good? Can you give me a quick cheese, please? Say cheese. Let me get that smile. I'm gonna go ahead and capture your before and after pictures. All right. I'm gonna upload this into the dental portal, and then next we can go ahead and start your braces procedure. Okay.
Okay.
So you did, hey, Dr. Chris, you did the cleaning already, right?
Yes, sir. We already did the cleaning, and I already did the first procedure in terms of her broken and cracked tooth for the root canal. Yeah, you can get straight into it for the braces. All right, it's all good. You don't have to do the cleaning. You can go ahead and just start doing the first procedure for the braces. All right.
All right.
I'm gonna go ahead and insert the cheek retractor for you so that you can see your teeth clearly. So first, go ahead and add that etch gel. Okay. You can add the etch gel for her, so that her teeth was already pretty clean. Perfect. You already set. So yeah, her teeth was pretty much already clean during the first procedure. We pretty much want to roughen the surface. Since it was so smooth, we got all the tartar and plaque off. We want to roughen them surfaces up a little bit, but not too rough. It's just the outside of your teeth, so that when we add those brackets and center those brackets onto your teeth for the arch wires to go through, it has something to stick onto. All right, and that's what he basically just did. He applied the Transbond XT primer, which is just an adhesive for those brackets to be centered on the top of your teeth.
Okay.
And like I said, it's just an adhesive. It seals the enamel, it takes out the moisture out of your mouth, and it allows the brackets to stick perfectly centered on the on your teeth, on each one of your individual teeth. All right.
All right.
So next, go ahead, Kev, go ahead and add those bonding brackets on there. All right. Perfect. Yeah, and it looks like the Transbond XT worked perfectly, so we don't need another adhesive. We did have another one in mind. It's called Brace Paste, but the Transbond worked perfectly for both scenarios. All right. And I'm gonna help Dr. Kev go ahead and carefully place these on there as well, so that we can get through this a little faster. He's carefully placing them on, and I'm doing the bottom rack. He's doing the top rack. Okay.
Okay.
Kev, can you go ahead and get the blue light out, that LED light? We need to get the VALO Ortho cordless out. All right. So next, basically, we're going to get an LED light, and then basically the adhesive that we put on there, that Transbond XT, that adhesive we put on your tooth, it has to harden. Otherwise, it'll be runny, and your brackets won't stick onto your teeth. So we need the LED light to pretty much quicken this process up and harden it as fast as possible, so that we can stick those brackets on there and then put the arch wires on there. All right.
All right.
Bet. So Kev, where's the LED curing light? You got that, buddy? Perfect.
I put it.
That's a bad. I see it, buddy. All right, so I'm just gonna use that. Yeah, the blue light. It's just like the blue light is just monitored in nanometers. All right, And so he first started off at 420 nanometers, and that's just a recommended start off point. And it seems like it worked perfectly for your teeth. If it didn't, we would have just upped it up a little bit, the nanometers. But it seems like it was a success. So we don't need to up it up anymore. All right.
All right.
And next, he's just going to apply those arch wires through. Let me go ahead and hand you these Wineguard pliers. Give me 1 second, Kev. All right, bet. There you go. So next, basically, this is the elastic bands that we were talking about. This is where the coloring comes into play. A lot of people think it's the arch wires that you see the coloring, or it's the actual brackets, but really it's O-rings that fit, or elastic bands that fit over those brackets that we already centered on your teeth. And that's what produces or shows the coloring. In your case, we're going to double back. You said it was black is your favorite color, so we can go ahead and add black on there. But if you want a different color, just go ahead and let us know now, okay?
Black is fine.
Black is still good. All right, so we're set on black. All right. You can go ahead, Kev.
All right, I need the black O-rings so I can put it.
All right, bet. So I'm gonna go ahead and put that for you. I'm gonna apply the ligatures, or the O-rings as they call it, okay? And we're gonna go ahead and apply those O-rings. Perfect. We know that they are black, okay? We applied the black O-rings, all right? And lastly, we're pretty much just going to trim that excess wire, just so there's no uncomfortability, just so that the wires are not sticking your gums, they're not sticking the inside of your cheeks, or the top, scraping the top of your roof, and just so that no food particles or anything pretty much break that wire off. We need to trim the excess wire. So go ahead and trim that for me, Dr. Kev. You got that? Do you got that, Kev?
Yeah.
All right, bet. Bet. Yeah, so we both did it. Yeah, we're pretty much set now. So that completes pretty much your full procedure. I'm gonna just do a quick summary. So we did a checkup, we did scan, CT scan, and X-ray scans. That led to us seeing that there was unexpected crack and broken tooth in the back of your mouth. All right, and so therefore, before we did the braces procedure, we had to fix that tooth. All right, because we don't want to put any braces over any damaged teeth. All right, so then we proceeded with the cleaning. We cleaned your teeth, of course. All right, and then we addressed that particular tooth. All right, and we did a root canal for that tooth that was cracked / broken. All right, we fixed that, we filled it. All right, and then we placed a crown over top. Is now healed, is now strong, is now healthy. All right, and now you can pretty much eat as usual, since that is your chewing part of your chewing teeth in the back. All right. Next we were able.
I'm about to go get the meds for her.
Okay, bet. Appreciate you, Kev. Next we were pretty much able to put your braces on. We did your full top rack, but we left a little bit of space in the back for your bottom rack because we did that procedure. All right, and so pretty much a follow-up can happen, but we're probably going to pretty much leave it as such. We didn't see any too much misalignment with your teeth on your bottom rack. They seem pretty much all aligned and in good condition. Normally when we do the top rack, we want to make sure we do the bottom rack, and you're pretty much all set. All right, you're all good. And next is pretty much just making sure that you get the right supplements and vitamins from Dr. Drawn, so that you can go ahead and continue to have healthy teeth for the next follow-up. Okay, so I'm going to schedule you a follow-up appointment if possible. I recommend within a week. Okay, I'm going to go ahead and prescribe you some medicine as well. 200 milligrams of ibuprofen, which is basically Advil for the inflammation, and then I got 500 milligrams of acetaminophen, which is basically Tylenol for the pain. Okay. Dr. Kev already went ahead and got that those pills for you, so he's gonna go ahead and prescribe you those pills. Okay.
That's something like that. 500 milligrams and the 200 milligrams of 200 milligrams of Advil, 500 milligrams of Tylenol.
Perfect. That sounds good. You can go ahead and hand it to her, buddy. All right. And lastly, we're pretty much going to go ahead and direct you to the waiting room. Well, we can just go ahead and take your gown off. Dr. John can go ahead and. Do you want to hand her the discharge papers, or should we and then you just do a little quick briefing in terms of the supplements? How you want to go about it, Dr. John?
Yeah, so I'm gonna have Ms. Sims take her to one of the private rooms. So I could get her started with the rest of the lifestyle plan that I have planned for her.
Bet. So we're going to go ahead and tell you to go to the waiting room or resting room, and you can receive the discharge papers from us. And then John, like you said, he can go ahead and incorporate his procedure with you in terms of everything with the nutrition and everything that's happening in terms of his department. And let me just go ahead and get a follow-up appointment for you. Is there a specific date or time that you would like? Like I said, I recommend within a week. So since today's Thursday, at least next Thursday, but we can do any other day if possible. Okay, so just let me know. Okay.
Thursday is good at the same time.
Thursday, okay. And what was it? 12 o'clock Eastern time. That's perfect. So I'm gonna go
1
ahead
o'clock.
and put you in for that time. That's a bet. Okay.
All right, 1 o'clock though, not 12.
Got you. Bet. Sorry for that. 1 o'clock. Okay. Yes, I'm done with it.
All right, thank you so much.
All right, Ms. Sims, can you take her to one of the private rooms, please?